Let's turn to a Rise News Analyst, Associate Professor Sam Amadi. Thanks very much. Do you see this as a jet-knee decision? Is the British government not being hasty because laboratory tests have not said, oh, the Omicron variant is so devastating, or, you know, like the other ones?
Well, I think maybe, I won't say hasty, I can say maybe unfair in terms of looking at previous responses. I think like the minister, the health minister put it there, they are responding maybe as they envisage, but there's some kind of hysteria. First, if you watch some of the bans happened even when cases were very few, like the 6 Southern African states that were banned, travel ban were imposed when there are few. And the argument has been that if you look at the original coronavirus, even designating China as even the source was controversial. The World Health Organization and the countries were reluctant to slam China with any kind of ban. And so it looks like this is geopolitics again, not just science, because Africa is a soft target, and it's easy to, even without many of the cases coming through, since last week, significant ban. And European infection is also growing in the sense that often it's no longer a case of index cases now; it's also a case of transmission. So, so if you look at the European countries themselves, many of them have significant cases. So would they ban themselves from? Because essentially, it's not just about 2 people, 3 people coming from Nigeria and infecting, let's say, persons in the UK. It's also people in the UK who are not infecting the rest of themselves and Europe. So the argument has been that the response is not really scientifically fair and balanced and effective. If you're going to ban travels in and out of Africa or some African countries, now Nigeria, a major economy, South Africa, a major economy, then you want to say this is really like, this should be an extreme measure.
So it's like a sledgehammer, approach and killing a fly.
Exactly, and that suggests some level of, if it's not racial focus, at least geopolitical consideration. If Nigeria was a country of much foreign policy significance.
Are they kowtowing the economists' views on, the COVID incidents in Nigeria and the Western comments? Oh, that this new variant now, it's like Africa is going to be a graveyard.
Well, we know that maybe happily too, this variant, even though we're not sure it originated from South Africa, people are arguing that South Africa gave us the information. It doesn't necessarily mean that
it originated from Netherlands.
Exactly.
Netherlands had it on the 17th before so 3 days later, 4 days later.
South African scientists were
proactive to come out and say, look, there's a new variant that is mutating.
So it's wrong to call it an African variant. Again, if you look at this variant, we learn that transmissibility is high, but fatality is very low. Hospitalization is very low. And for public policy, public health response, what you look at hospitalization that may lead to deaths, and also involve a lot of response, a lot of resources and trade-off with people who are sick who may not have, hospital beds. So since low impact, low death rate, low hospitalization, maybe high transmission, it's not enough to kind of cripple the world economy.
So you just ask why the rush?
It's too disproportionate. And again, the is to target this African with travel ban, and if you point back to what happened in other cases, we had the Delta variant that was much more fatal in terms of death cases and hospitalization rate. We didn't have this knee-jerk or quick response in terms of ban. So people are arguing then that maybe African countries should do some tit for tat. It might not be in this sense. I mean, because in international relations, dignity matters. African countries have been called out so quickly. The South African government and head officials are not happy. They are saying, look, we are doing enough to help. And
well, the South African president and his Nigerian counterpart during the visitation during the week or so, they agreed that they are not going to place undue restrictions on
Europeans.
Yes,
but the case is they should make some strong representation on the fact that perhaps this travel ban should be eased quickly.
Shouldn't our foreign minister and ministry, be doing that?
As a matter of fact, the African Foreign Ministers Forum, or even
that you're talking of AU now.
AU, even some of the states not already mentioned, but 8 now and more counted, should have come together to issue a strong statement and engage WHO to put advisory. Because yes, it might be that these countries are being proactive in trying to put it, but if you look at the caseload and look at the impact in terms of hospital and death, maybe, and then the effect of a travel ban for a country like ours that depend more, with that whose economic relationship with Europe and America is lopsided. It means that the impact will be huge. And this is season like Christmas when you expect a lot of movement. We're talking about remittances, sustaining, helping with revenue and economic well-being. And so this is a period where people come back home to support relatives in informal way with some mitigation of the poverty case. So it'll be harsh, I think.
Yeah, very interesting here because you've brought the economics of COVID-19 into play here. And the British Health Secretary, Rajiv, was saying that it is only that travelers from Nigeria will be quarantined in designated, isolated centers for 2 weeks at a cost of over £2,560.
Basically discouraging travel between Nigeria and London through and fro for this moment, because you see, those are hotels. Usually, most of them are actually hotels they use for those quarantine. Secondly, they're going to pay 2,000 plus something pounds, okay, for the days they're going to be quarantined. So it discourages. It's actually a tax, but again, the question is, should the state bear the responsibility? People have argued that once they're going to quarantine you, then the state, you should pay the cost. Again, this will discourage travel, and the point here is that
why wouldn't the British government, make a choice?
But by the way, they don't even want you to come. They don't want to travel. The quarantine is second-hand. Okay, if you must quarantine as a citizen, as a legal resident, okay, you must travel. You must come at this period. They will have to put you on that quarantine. So essentially, their preference is to freeze movement between Nigeria, those African countries, and the UK. So the option of quarantining you is actually cost-based, because it's a further disincentive for you to make that travel. Primarily, one can argue, yes, state police want to protect themselves, but the point is that
they are losing revenue too, because a lot of tourists pouring into London and other sites in the UK.
Absolutely, but don't forget that in terms of Christmas, the movement is the other way mostly. We would probably spend our Christmas at home with our relatives. Summer we would like to go. This is winter, so the movement towards Europe and UK, Europe and America is less. The traffic is probably
more
this
down
way
to
of
Africa.
Diaspora coming back, who are citizens, but also citizens of African countries coming back. So that's one thing to consider. Again, the idea is that people are not looking at, is it science that's driving most of this response now, or politics and excessive hysteria around infection rate going up? And of course, we know that there's some uncertainty around it. So if it becomes a major case that could cripple or lead to another shutdown, what the government loses will be massive. What the state will lose in terms of revenue. And so I think preemptive measures, there have been criticism around late deployment of strategies in the first wave. The countries did not respond quickly. Some people have argued that
just as the world is not responding quickly to the equitable distribution of the vaccines, and that's why we're seeing in the West the COVID-19 is spiking. Of course, this some people who argue is the season, the cold season.
Flu. But again, looking for Africa, the question is, we don't have vaccines. We're not vaccinating at a good rate. At the same time, we're not having too many pandemics in terms of fatality. So the question is, maybe because we're enjoying a better climate now, but ultimately, if we're not vaccinated, the fear is that Africa could become a place where a lot of mutations can happen, because essentially, if there are too many unvaccinated persons, the argument is that the rate of transmission will be higher, and then we might see ourselves being slammed from time to time with this kind of reprisals or this kind of emergency measures that further cripple, and not just cripple, it internalizes a psychology of inferiority, you see. So the way Africans are perceiving it is not just the economic crisis that it creates, not just the fact that logistics, movement, businesses will be crippled, but also the sense that Africa has been exposed as a weak partner in this global coalition, in the sense that they can outsource harm to us. 2-3 index cases we are banned. But when we had several cases, even from Asia, there was a time that Hong Kong and others had serious issues. Travel bans came late. So there's this big debate that there's something either if it's not racist in contention, it's at least geopolitical. It is not that Africa is of least consequence, and therefore African voice is muted, and therefore we can slam down, possibly shut down Africa. Assuming what happened in China, elsewhere, in Italy, France, the level of case and hospitalization and death happened in African countries, maybe they could just shut down Africa completely. So that's really the debate now. How wise are these measures in the context of the vulnerabilities, the lack of vaccination, the poor rate of African economy, the slow recovery from the pandemic? And
why it is not really devastating us in Africa.
That's the point.
Thank you so very much, Associate Professor Sam Amadi, a Rise News analyst and lawyer.